One is for the Bhedaniya property. I'm just expecting the answer from you.
Any Rachel or Manchester? So it's saying Haridra, Rachel is saying Haridra or Manchester. So
No, wrong.
Okay, you got which one out? Haridra and Manchester. Oh, Manchester is out? Oh no. Yeah, money was on Manchester. Sorry,
So let me, because I need to explain you other cases as well. So let me go to the point in Avipattika Churna. What salt were explained?
That's Vida.
Vidalavan. So everywhere Saindhava is Shrestha. So here why Vidalavan is explained? Come on. How many types of lavana are explained in Ayurveda?
Vida is seven, right? Vida is seven. How many types of salt? Dr. Sham's class. Yeah.
So let me come to it. Yes, first one is Saindhav. Saindhav is the best lavan in Ayurveda, right? Then the next one.
Black salt.
There is a Saindhav lavan. What are the properties of Saindhav lavan mentioned in our Sahitas? So Saindhavam tatra saswadu. Saindhavam is Madhuraina rasa. It is Vrusha. It is also Vrusha. It is Rudya. It is good for heart. It is Tridosha Nuta. It is actually Tridosha Gna. And Laghu. It is very easy to digest. It is not that Ishna. It is Drushya. It is good for your eyes. Then it is Pathyam. Plus it is Agni Deepanam. So that are the gund of Saindhava Namak. So Saindhava, in Dhanvantaram Tailam we have seen that rock salt is explained, right, in gynecological disorders. Right? So thereafter there is a Savarchal salt, then there is a Vid salt. So what are the gun of Vid salt? And that is the main Bhedak Dravya. Because everywhere in all the medicines you can see there is a reference of Saindhav Namak, but in Avipattikar Churna, and that's why I have chosen it for my patients of gallstones. So you can see there is a reference of Vidalavan. So Vidalavan is mentioned, that is because of Vidalavan the cough started coming out from Urdhva Bhaga. Apan Vayu started, coming down from the, anal orifice, and it is like Kapha and Vata Anuloman. It is Kapha and Vata Anuloman. It actually good. It is improves your digestion. It improves your Jataragni. Plus, it is good when your Mala Mutra Sangha is there. There is a constipation or there is difficulty in passing the urine. Plus, it is very good in Anaha when there is a abdominal discomfort. Anaha, then, we all term, you must be aware, that is Anaha means fullness of the abdomen. Atop, all these things, you must be aware. And Vishtabdha, when there is less peristalsis movement. And there is a Shula and heaviness. So where it is mentioned, Vidalavan,
It's another.
In Sanhita, where it is mentioned? It is in Ashtanga Hridaya, Sutrasthan, Anna Swarupa Vijnani Adhyay. So all sort of Lavana are mentioned, and everywhere it is mentioned that Saindha Vishreshta, the Saindha Vishreshta, but in Avipattikar Churna there is Vida Lavan, and that Vida Lavan has that property of Bhedan, and that's why, because it is very useful where there is Sangha. So Butrashmari is the Pittashmari is somewhere the Sangha. So it is very good where there we observe the Sangha. The shloka is Urdhva Adha Kapha Vata Anulomanam. Urdhva Adha Kapha Vata Anulomanam. Then Deepanam. It boosts your digestive power. Vidam. Then Vibhanda. Where there is a Vibhanda. Bandha. Jahan pe bhi bandha, Vibhanda means there is problem with the a stool, then there is a problem with urination, so that vibhanda, anaha, then when where there is a fullness of the stomach, when there is a vishtabda is because of vata, then when there is a shula, when there is a pain, it is gaurava, when there is a heaviness, it is all nashanam. So Vida Lavan has that Bhedan property. And all other are to balance the pitta and to giving nourishment to the pitta guna. I just want that, I don't know on next time, Anu ma'am, when we are going to take the lecture, but from these students I want that they should be come up with the vata, pitta, kapha, three dosha and their guna.
Yeah, they finished it. The basic principle one class, right? Yeah.
I will take one class, no problem. But it is very important. Why I am telling you this? Because it is very necessary. When you understand the Vata, Pitta, Kapha, then only you will able to understand the Ayurveda, and then only you will able to understand that why Shatavari, why Vida Lavan, why Manjishta, why Sariva, why we should hit the lemon and why should we add it. When you will understand this, and why Pittashmari is happened, why Mutrashmari is happened, for that you should know all the the basics of Ayurveda, that is Vata, Pitta, Kapha, their gun, and how we can give. Because see, if you will see all adhyay of any though it's Ashtanga Hridaya, Charak Samhita, in Chikitsa Sthan, it ends with some rejuvenation therapy like Ghrutapan or some Rasayan treatment. Is there any single adhyay where Ghrutam is not explained? Even in Apasmar Chikitsa, which is psychological disorder, there also the Ghrutam is also explained. That is one of the best Ghrutam, Mahapaishachika Ghrutam, Balanam cha Angavardhanam. So that is also in psychological, Unmad, Apasmar, epilepsy patient, psychological disorders. In all this condition also, they have well explained the treatment. Their line of treatment ends with the Ghrutapan, some sort, because Ghrutapan work as a rejuvenation. Always our Chikitsa, Ayurveda Chikitsa ends with the some sort of Rasayan Chikitsa, that is rejuvenation. So our specialty is that only, that we are not just treating, but we are making our body that much strong that again that disease will not come to that patient. Am I clear?
Yes.
Yes. So any other questions? So definitely for your friend who have, because as you mentioned in US there are so many patients of where there is need to remove the gallbladder. So there you can give the medicated water, simple Jeerak Mishreyam medicated water. That also you can give for the consumption, everyday consumption. You can ask, sometimes you can take Saindha Lavan, sometimes you can take the Vida Lavan as well. Then many a times you can ask to take some sort of, like as I mentioned with black tea or black coffee, they can take 1/4 spoon of castor oil as in the morning itself. many a times they can take a Vipattikar Churna, and the treatment should not start with Aushadhi. It should be start with Ahar, Vihar and Aushadhi. So please, anyone can summarize this 2 cases and line of treatment. Come on, fast.
Yes. Yeah. Did you guys understood the treatment principle?
Yeah.
Treatment, yes. Cases, let me see.
That's fine. That's fine. You can generalize it. Not necessary. We don't need to remember the case name and age and everything. We just want to understand what exactly in Ayurveda diagnosis, what is the pathophysiology and how we can give the treatment.
So there were 2 patients, both with gallbladder stone, and one of them had a bigger one and the other one had a smaller one. So the line of treatment was Pitta Shaman and Pitta Prasadam.
First of all, correction of the diet.
Correction of diet, yes.
Yes.
So Pitta Shaman diet and we had Amla Sariva Majishna, Burnt Mindu, Shikali Haritra, and Abhipatika Shuna for their other part. That's
Yes, very good. So basically, I want to, summarize this case with that there are some medicines or there are some, the things which are mentioned in Ayurveda which are Nitya Sevaniya, which one should eat every day. So in the cases of gallstone or in like the patient who unfortunately underwent the surgery for their cholelithiasis or cholecystitis, Nitya Sevaniya Dravya, there are 2 medicines, that is, the Manuka, that is black resins, it is mentioned as Nitya Sevaniya, plus it is mentioned one more thing, that is Dadima. It also has, Madhur plus Amla Vipak. So Dadima Swarasa, Dadima Gruta, all these things are mentioned. Dadimadi Grutam is also there. So you can use that Dadima plus resins, black resins. Manuka is also mentioned that you should eat every day. So you can ask the diet from Nitya Sevaniya Dravya. In Ashtanga Hridaya it is mentioned that there are some, things that everyone should eat every day. So I think so now we should go to next case.
Dr. Jyoti, we'll take a 5 minutes break.
Yes, sure.
And
Yeah, sure. We'll see after 5 minutes.
yeah,
Sure.
one more. That's it.